I can tell you without a doubt, if you can master your sleep position, you can master your quality of life. Do you suffer from a stiff neck? Maybe you have headaches or migraines, or a pinched nerve that refers down your arm, tingling into the fingers. Does it wake you up out of your sleep? Or maybe you wake up in the morning with it. If this is you, the likely culprit is your sleeping position. Providing you with pain relief strategies and wellness solutions for modern day living. My name is Dr. Jon Saunders. I'm a chiropractor here in Newmarket, Ontario, Canada, and in this video I'm going to show you the best position to sleep in and the appropriate way to use your pillow. One of the most common questions I get asked in clinical practice is, how should you sleep? How should you use your pillow? Is there a way to minimize neck pain, headaches, numb fingers and hands while you sleep? And the answer is absolutely. If you want to minimize neck pain, headaches, tingling in your fingers, pinched nerves, or just minimize the future problems that would be created by an improper sleep position, then I'm going to show you exactly what you need to do. Now, in order to understand why the only two positions you should sleep in is either your side or your back, we need to learn about neck anatomy. Neck anatomy is very important to sleep position because what we want to do is we want to minimize the stress on all the tissues in the neck to minimize your pain and for you to have an awesome sleep. One of the things we know is that a normal neck has a nice natural smooth curve, as you can see here. There are many tissues in our neck that can cause pain: joint capsules, facet joints, intervertebral discs, muscles, tendons, your brachial plexus or nerves. Even your rib heads can get irritated if you sleep in the wrong position. So the theme needs to be, how can we minimize the stress on all these tissues and have a good night's sleep? We're going to talk about back sleeping first. I want you to visualize lying on your back. You want a pillow to support the neck, not the head. So when we're choosing a pillow or positioning a pillow, it needs to be focused on the mid portion of your neck to allow that curve to be naturally in a relaxed state to take all the tension off the nerves, the joints, the discs, the muscles, the ligaments, and the tendons. So how do you do that? You need an appropriate pillow. You want the pillow, as I say, not to be on the head, but on the neck or supporting the neck. And it doesn't really matter what type of pillow you have. It needs to be positioned so that that natural curve is being followed and taking tension off the area that causes the most discomfort. The primary concern should be restoring or maintaining that nice, smooth, natural curve. Whether you have arthritis, a disc bulge, or disc herniation, the goal should be minimizing the pressure on those tissues that are causing your pain or stiffness. The other position that is acceptable is when we're sleeping on our side. So again, what is normal posture when we're standing or sleeping on our side? It should be a very straight spine. There's a few things that happen when we're sleeping on our side. One of which is that we're not using that pillow in the correct way. One common mistake when we're sleeping on our side is we're using the pillow for a head support, not a neck support. You need a pillow that you can either position to fit the distance between your shoulder and your neck. So again, a neck support is important. The right size pillow will keep your head perpendicular to your shoulders. If I was sleeping on my right side and my pillow was too small, my head would compress on the right side and stretch the opposite side. That is not good. And just the opposite, if your pillow is too big, then your head will be pushed in the opposite direction, compressing the left side and stretching the right side. Another problem with side sleeping is the position of our head relative to our thorax or shoulders. Oftentimes, when we're in the right position, we ruin the position by flexing our head forward into the fetal position. Now, what that does to the neck, if you are in the right position, but then you flex forward from the side, then again, you're putting undue stress on these tissues in the neck. So you're allowing the neck to come forward, or allowing that flattening of that curve or that head to come forward. Muscles, ligaments, discs, nerves, joints, the spinal cord itself, and even blood vessels will become stretched. So it's very important that if you're a side or a back sleeper, you're thinking in terms of what can you do to support the natural alignment and curve in the neck. Reminder, pillows are for your neck, not your head. So what if you sleep on your stomach? Well, the simple answer is you need to change it. If you are face down on your bed, you cannot sleep with your head in neutral position. It has to twist. And when it twists, it stretches, again, the same tissues. It stretches the discs. If there's a disc bulge or herniation, it's going to irritate it. It stretches the muscles, the nerves, the joint capsules, the spinal cord, the blood vessels. If you're face down and you have to turn your head, that is a massive amount of stress on your neck that we want to avoid. So if you have a habit of sleeping on your stomach, it's something you need to change. It's a very difficult habit to change. In fact, my wife used to do it, and the only thing I could do was to give her a little bit of an elbow to kind of remind her to change over in the middle of the night. What finally did it is when she got pregnant, she was unable to sleep on her stomach. If you don't have someone that can poke you, or you're not planning on getting pregnant, then what you need to do is this. Start in the correct position. Start on your back with a supportive pillow under your neck, not your head, and not so thick that it's going to force your head forward. Or if you're a side sleeper, start on your side and find a pillow that will fill the gap to keep your head neutral or perpendicular to your shoulders. Now you're going to wake up in a wrong position, and that's okay. What you do when you wake up, you just get back to the regular or the correct position, whether it be on your side or your back, and repeat. Soon enough, your body will create a new habit, a new pattern, and you will be waking up way more refreshed, little to no pain or discomfort. You won't be stiff, and you have so much more energy, and it will be a habit that you'll be thankful you're able to change. I do want to say this, is sleep is vital. Do not jeopardize your quality of sleep by becoming stressed out about your sleep position. Follow the pattern change I suggested, starting and then getting back to the position when you wake up. But sleep is important. If you are not sleeping, you are not functioning. Your body is breaking down. It's unable to heal. You'll have less energy. Your immune system won't function well. So prioritize your sleep and then work in to the proper sleep position. If you like this video, hit the like button, share it with someone you know that needs help, maybe someone that isn't sleeping well, or someone that has a cervical disc herniation or a bulge, maybe they have neck stiffness or arthritis or headaches or migraines. These tips will help them get a better sleep and wake up more refreshed. If you have a question, please comment below. I will absolutely answer it. In the next video, I'm going to share how to sleep if you have back pain, sciatica, a pinched nerve, a lumbar disc herniation. We're going to go through the steps just like we did for this video, but we're going to focus on the lower back and pelvis. Hit the subscribe button below. We're going to give you more valuable content that can help you live a better life, pain-free. I just want to thank you for watching this video. My name is Dr. Jon Saunders. I'm a chiropractor here in Newmarket, Ontario, Canada. I can't wait to see you on the next video. Thanks for watching. To learn more how you can get pain relief from common spinal-related conditions, please visit us at www.chirofirst.ca. Our office is located Chiropractic on Eagle in Newmarket at 407 Eagle Street, Newmarket, Ontario, L3Y 1K5.